Partial knee replacement is a solution for knee arthritis when the arthritis is isolated just to a part of the knee. Commonly it's the inside of the knee, or kind of where your knees knock together, and that really is the most common area people wear their knees out. There are some patients who don't have arthritic disease in all of their knee, and sometimes it may be an overkill or too much of a surgery to replace every part of the knee when really the arthritis is only worn out in one part of the knee. And so the partial knee replacement is a surgery that really makes fewer cuts around the bone, and so recovery can be more quickly achieved. The hospital stay certainly is shortened routinely, oftentimes just, I would say most of the time, just an overnight stay. Oftentimes these patients are a little bit younger than the patients who need a full knee replacement, but really age in and of itself is not an inclusion or an exclusion to this procedure. Patients who have arthritis isolated to the inside part of their knee have an intact cruciate ligament. The ACL is the one we hear the football players tearing all the time. That ACL has to be functioning because that allows the knee to pivot normally, and that allows the arthritis to stay just on the inside part of the knee. It also has to be a correctable amount of bow-leggedness so that we don't collapse the outside healthy part of the knee. What we do is a special view called a stress view, and we use a special x-ray called a fluoroscan to, under live video, so to speak, with the x-ray, can put stress on the knee to ensure that this area opens up and this area does not collapse. And if the patient still is a candidate radiographically based on these parameters, then we will plan on doing their knee as a partial knee replacement rather than a full knee replacement. Now sometimes we've done these x-rays and are ready to go do a partial knee replacement. I do have a long conversation with patients preoperatively in the office that if we get into surgery and your knee does not look like it's going to do well with a partial knee replacement, then we are prepared to convert that procedure to a full knee replacement. Because the last thing any of us want, certainly the patient and certainly me, is to do, again, the wrong procedure for this patient. One of the benefits to a partial knee replacement patients are really interested in is a smaller incision. My tongue-in-cheek joke with patients is, an incision heals side to side, not end to end, so it really doesn't know how long it is. But certainly, if we can get things done adequately, satisfactorily through smaller incisions, that is better from a cosmetic standpoint, but really limits the surgical injury to the knee and can help patients rehab more quickly. As soon as we close your skin, it's ready to be walked on, and we really do get these patients up. We don't use any nerve blocks with the partial knee replacements. I do use a long-acting numbing medication around the knee, which allows them to be fully functional, have full control of their limbs, so they really diminishes the risk of falling. They can be full weight bearing. We get them up with therapy that afternoon, watch them overnight, really for some antibiotics, make sure their pain is controlled, they're breathing okay, having no other problems after their anesthetic, and then get them home the next day. We get them started in physical therapy within 2 or 3 days, formally sometimes with home health therapy. Oftentimes these patients can get to outpatient therapy. The rehab really is at a minimum about 6 weeks, but by about that time folks are back doing most things they want to do. It is an implant, and we limit the type of activity you can do, but certainly we want you walking on that. Low impact, high energy activities like biking or elliptical machines are important, and can keep your stamina, keep your strength, to help keep your balance, keep you in shape so you can keep your weight down so you don't develop arthritis in other parts of your knee or other parts of your body.